Okay, now we're going to go up and talk to Joe and Ellen in medical rehabilitation. We're going to talk to them about the opportunities we have in physical therapy and occupational therapy. If you could tell me a little bit about the treatment we're going to be witnessing here.
This is Diane. She's had a total hip replacement on her right hip about 3 weeks ago. And she's still having a little trouble at home being able to do her everyday tasks. So that's why she's receiving occupational therapy here. Today we're going to go into our bathroom and I'm going to show her the proper way and the safe way to do a tub transfer. An occupational therapist looks at the function of an individual. So I would evaluate a person and see what they are able to do functionally, such as getting themselves dressed or bathed, toileted, see if they are able to make a meal for themselves after they've had any sort of injury or a stroke or just generally sick. There's a few things you're not allowed to do. We're going to go right in here, Diane, with a hip replacement, just to protect that hip so nothing goes wrong with it. And one of those things is you're not allowed to bend over, you know, to put your own socks or shoes on. I chose occupational therapy basically because I was always interested in math and science in high school. And throughout my college years, I kind of didn't know what I wanted to do because I didn't know all the different options. So one day I was explaining this to one of my friend's mother, and she said, well, what about occupational therapy? And I'd never heard of it before. And I still come across that quite a bit, where a lot of people don't even know or haven't heard of what occupational therapy is. But as I looked into it and did some shadowing around different area hospitals and different settings, I was able to see what it was and really decided that that's what I wanted to do. So what I'm going to teach Diane today is how to take her sock off and put it back on with just the use of a couple of instruments that are very common with OT.
Could you tell me a little bit about the field of occupational therapy and why it's becoming such a growing field and there's so much interest in it?
Occupational therapy is a growing profession simply because there's always going to be the need for health care. There's always going to be sick people, unfortunately, and I think the healthcare profession in general is recognizing the need that patients have to be able to improve themselves functionally in order for them to return home instead of, saying, going to a nursing home or having somebody to come care for them. If they have somebody that can prepare them to go home independently, that's a big advantage. One of the reasons that I came to work at UHS is I knew that I would get the opportunity to work in a variety of settings. A lot of people work in the school districts. There's a specialty, hand therapy is growing, and that's big. And here at United Health Services, we have several different opportunities to work in different fields. Right now we have 2 different rehab floors here at United Health Services where you can work with patients for a longer period of time and really get to know them. We also have the acute care setting where you are able to work with patients with a variety of diagnoses. You get a lot of experience. We have pediatrics, we have outpatient setting, we have a new and up-and-coming lymphedema program and a driver rehab program. So there's a lot of different things that you can do.
United Health Services really has a great pay and benefits package. First of all, we have a wonderful PTO program. We have a fully hospital-funded pension program. You know, we provide a flexibility in the work environment that people truly appreciate and truly enjoy. The majority of our employees are actually work less than full-time. Many people work part-time and still are able to balance work and life and make a great living while they're doing that.
Occupational therapy is here at the hospital as part of a rehab team. Physicians and nurses and respiratory therapists and speech-language pathologists, physical therapists, and it's very good to work with all of those people and work together as a team. So there's always a lot of communication that you have to do with how a patient is doing, what kind of treatments work best, and also just great interactions with physicians and with the nursing staff and the acute care side of the hospital, just to make sure everything flows together, because we really work together as a team to give the patient what is best for them.
Okay, great.
Okay, so to put that sock back on, Diane, is your foot getting cold?
Make sure that the heel's right in line.
Hey, Joe. How you doing?
Good.
Here to talk to you a little bit about what you're doing with your patient here.
Wonderful. You have the ability to be able to help people to and improve upon not only their injury, but also any other issues that might go on with them while they're with you for anywhere from 4 to 6 weeks. They see me 45 minutes to an hour at a time. So you really get to understand that person. The different types of environments we have here at UHS, one of them, if we start at Binghamton General, is Sanford Rehab, where they have the rehab component where you might see a patient every day, 3 hours a day, for 3-4 weeks. And that involves cerebral vascular accidents, maybe a total hip or total knee replacement, someone who's just severely deconditioned. The other component at BGH is the hospital setting, where you might see a patient on any floor for any reason, coming from some sort of infection to pneumonia or deconditioning or a fall and a fracture, a motor vehicle accident. Over at Wilson, you'll see that same component, but you also have more of the surgical component to it, which is you might see a back surgery, a neck surgery, and those are seen post-op the day after, and you're the first one to see them, so it's quite interesting. There's also the outpatient setting, which is where I'm at, which we'll see patients from inpatient coming out to us, but also what we'll see just from off the street, patients who have sprains in the ankle or shoulder pain or back pain.
And Joe, how long have you been working here for us?
Let's see, 8 years.
Okay,
8
great.
Years. Yeah, I came here, 7, 8, it's almost 8 years. I came here in May of 2001.
Okay.
So.
And you were part of our education incentive program, correct?
Yes, I initially came here as a physical therapist assistant, and then I moved on, as you basically stated, to a physical therapist. I went to school for a couple years at Broome, and then went another 3 years at Mercy College. So I was in the incentive program for the first couple semesters, and then I went into the scholarship program, which basically the hospital pays up front for all your schooling. Schooling for 7 years is anywhere from $70,000 to $100,000 to $120,000. So if you can have an employer as nice as UHS to pitch in and pay for some of that, it's definitely a nice benefit that UHS offers here.
We will also provide people with tuition reimbursement, which is something once they become employed, if they choose to go back to school to further their education, there's a program through our benefits department that will allow people to go back to school and have their education paid for. So we are committed to furthering the education of our employees and the people in our community to meet our needs for healthcare professionals. What are some of the advantages of working here at UHS?
There's a myriad of different patients that you can see in different environments. Mm-hmm. So that's probably the biggest thing that when it comes to UHS. You know, definitely as a new grad coming out of school, if you're really not sure what type of environment you want to work in, you can go ahead and basically start from one position, work there for 6 months, and then go ahead and rotate to another environment if that isn't really what you want to do.
Okay, great. Joe, thank you very much for your time. We
Thank you.
appreciate it. And thank you for being a good sport and letting us film your treatment.
You're more
Thanks
than
a lot.
welcome. You guys
Great.
take